I'm just saving you the embarrassment of them taking the shot.
I trained Paul beyond to it, so.
We're well past embarrassment.
All right.
How are you all? How's the weekend?
Good, thank you. Yours?
Yeah, busy. It was good.
Continue.
Thanks very much. Everyone's right to go.
Thank you.
Terrific. I'm joined by Kevin and Con from Coles. I'll have a bit more to say about them in a minute, but I thank them in advance for being here today. It's a busy time for our supermarket workers in so many ways. Some of the great heroes of the last couple of years going above and beyond to keep us all fed, doing amazing work. I'll come back to the reason why our friends from Coles have joined us today. But in terms of numbers of the day, I'm very pleased to be able to say that 32% of Victorians 18 and over have now had 3 doses. That's up from 31.1% yesterday. That growth is steady. That's great. But we have to do more and we have to do better. And that's why we made decisions yesterday to mandate teachers and staff across our education system as part of our back-to-school plan we announced, the Deputy Premier and I, yesterday. It has been the biggest Saturday and the biggest Sunday in terms of doses through our state clinics since October last year, which was really the peak of our first and second dose performance. Nothing's more important when it comes to protecting you, the people you love, and the people that we all count on, our nurses, our ambos and our doctors, the whole team across our health system. Nothing's more important for all of those reasons than getting a third dose. Free, available, effective. It is absolutely critical that people go and get their third dose, and I thank everybody who over the weekend, a hot weekend, went and got that third dose. Biggest weekend we've had in many months, and that blitz continues. Walk-ups, heaps of appointments available, easier than it's ever been. Our school pop-ups start quite soon. We will take this street by street if we have to, just as we did with first and second doses. But I just encourage people, with the interval down to 3 months, please book an appointment. Please honour that booking, as well as getting your kids vaccinated as well. I'll come to those in just a moment, but there are something like 161,000 bookings that are available for first, second or third doses. That's just across state clinics over the next 30 days. On top of that, there's the amazing job that our GPs are doing in their surgeries, and of course community pharmacy are playing a really important role in this vaccination rollout as well. So between the 3 sectors, the state system and primary care divided between pharmacists and GPs, there's never been more appointments available, and it's never been more important to go and get your first dose if you haven't had it, second, and indeed for the vast majority of Victorians, their third dose. Put it another way, 1.7 million Victorians have had a third dose, and there's about 2.2 million others that are eligible but have not yet had that third dose. So we're doing well, but we have to do substantially better. In terms of child vaccinations, 3,562 children got their first dose through state-run centres yesterday. A big and indeed solid performance across the weekend for children's vaccines. 176,371 kids aged 5 to 11 have received their paediatric first dose to date. That's 30% roughly of that age group. There are about 67,000 of those doses have been delivered through our state system, and we're very pleased to be playing our part in making sure that we get our youngest Victorians who are eligible for a vaccine protected by that vaccine. 21,000 children were booked in over the last 7 days for a first dose, and 5,000 for a second dose. But remember, you can't do walk-ups for our kids. They have to be appointments. but there are something like 65,000 appointments available over the next 30 days for 5 to 11-year-olds. So there are appointments available, and I'd encourage all parents to make that booking, get that protection, and begin that vaccination journey for their son or daughter. And I'd also make the point, I just want to say thank you to all of those parents and those kids who've been through the program to date. Now, in terms of other numbers that are critically important, 998 people are in hospital. That's down from 1,002 who were in hospital yesterday, and down from the 7-day average of 1,065. 119 people are in ICU, down from 120. 47 people are on a ventilator, up from 44. And sadly, I have to report that 17 Victorians have passed away with COVID, and we send our deepest sympathies and sincere condolences, our best wishes to their families. This will be a very, very difficult time for them. In terms of case numbers, 7,207 self-reported RATs on the coronavirus.vic.gov.au/report site. And I thank those people for not only getting a test, but also going and registering that positive result. Not just important for data and for the completeness of picture, but also it gets you into the system, and it means you're much more able to get the care and support you need, if in fact you need that in the days and weeks after your positive diagnosis. A further 4,488 people received a positive PCR result, so a laboratory test result from some 21,675 tests that were processed. That gives us a total of 11,695 positive cases and takes us to 186,073 active cases across Victoria. Average case number for the last 7 days has been about 17,412, so roughly 17,500. And the 7 days before that, it was 32,316. So again, about 32,500. I can also report that 33,000 rapid tests were handed out across our testing sites yesterday. This is really important in terms of access. It's really important, and I'm grateful again to all of our staff working in those testing sites, whether it's handing out PCR tests or processing laboratory tests, or the people working in the labs, all hours. They're all doing an amazing job, and we thank them. The whole team are doing their very, very best, just as I know Victorians are, being isolated, staying away from family and friends, having a very different summer break than what many had planned. But it's critically important to reduce case numbers and therefore reduce the pressure on our health system. I'll again make the point, we're not seeing as many people in intensive care, but we are seeing people that they're quite unwell. They're not critically unwell, but they are unwell enough to need a hospital bed. They're going into general ward beds. And with so many staff away sick, with so many staff, thousands of them, away because of or with COVID, that means the system is under significant pressure. So I thank each and every member of that team, and it's a big team, everybody from cooks and cleaners and ward clerks all the way through to nurses and ambos and doctors, the whole team. They're doing their very, very best in unique circumstances, and on behalf of all Victorians, I thank them for their commitment and for their hard work. Speaking of people who have got real commitment and work incredibly hard to give us the basics in life, the things that we need in some respects most of all, I am very pleased that Kevin Gunn, the Executive Manager of Operations and Transformation at Coles, and Con Hondrianis, who is a forklift driver out at the Laverton Distribution Centre for Coles, has joined us today. The reason we've asked him to come along is just to give you a bit of a sense of how things are going, but also to talk about the great success that the Victorian Jobs Network has had. We set this up some time ago. We then ramped it up once the pandemic came along. This is something like 120,000 Victorians that have registered with Jobs Victoria, and that's about getting training, getting mentoring, getting support, and getting the linkage between what business needs and those people who are out there who need a job, wanting to change careers, might be between jobs, might actually have had very difficult times in the labour market. Another job may have ended. Those supports are all about, in very practical ways, giving people a pathway to the job they want and the job that we more broadly, and business particularly, need them to fill, the work they need them to do. If you think about it, in most recent times, we've had some 2,000 people register their interest to work in our supermarket system, and that's critically important given that there are many hundreds, indeed thousands of staff, whether it be at Coles, at Woolworths, at Aldi or at the wholesaler Metcash, who have not been able to report for duty. So there are shortages there, and the partnership between our supermarket industry and the Victorian government, in many ways, but particularly through the Jobs Victoria network, is paying real dividends. Con was connected through the program some time ago, so not in the pandemic, but some time ago, and can tell you his story. I think this is a job that is perhaps the most rewarding and most fulfilling that he's ever had. So it's a great success story. So that's behind the scenes, the government working with our supermarkets to give people who are out of work the skills and support they need to do the job that we need them to do, particularly at times like this. It just goes to show through hard work and through innovative, creative partnerships where there's real goodwill, you can turn challenges into important opportunities, particularly for working people. I'll let Kevin and Con tell their story in more detail. The other point of our announcement today, the other part I want to talk about, is we've got a supply of some 25,000 rapid antigen tests, which we will provide to a number of key industries at on a cost recovery basis. This is just about dealing with some of those shortage issues. And as I've said a number of times now, each time I've stood up and given you an update on our ordering of some 210 million of these and the different shipments that have come through. Every million of these that we land into our state takes some pressure off the real demand pressure that there is out there for these tests. Not to say it's easy to get them, but we're playing our part to make sure that if we can supply them, then that means that some of our critical industries are not in the market having to source those at the expense of other consumers. So those 25,000 cost recovery rapid antigen tests will go to things like utility companies, food, so supermarkets, and that's on a cost recovery basis, and it's just our way in just for a short period of time until stocks are boosted at some of those critical industries of providing those rapid antigen tests, because we know there are a lot of staff that are furloughed. They're all exempt from the home isolation, but they have to do those 5 rapid antigen tests. This is us just stepping in to make sure that the rules work, not just for the business, not just for the worker, but they work for all of us in keeping stock on the shelves. And if we can create jobs along the way, particularly through those who've expressed an interest, some 2,000, then that's a fantastic outcome. Again, if you work hard enough, you can usually find the opportunities in any challenge, and this is exactly one of those cases. I don't want to, I probably can't repeat it often enough. I just want to, before I ask Kevin to come up and say a few words, and then Con, on behalf of the government and on behalf of all Victorians, can I just send a shout out? We talk about our health system a lot. We talk about people working in testing clinics and vaccination clinics. We talk about police and emergency services a lot. We can't thank those who work in our supermarkets enough. They've done an amazing job, whether it's front of house, people in the dead of night stacking shelves, people in warehouses, distribution centres, going above and beyond. It's so important, and they've done an amazing job throughout this pandemic, and I thank each and every one of them and their families for the contribution that they have made. So now I'll ask Kevin Gunn, the Executive Manager of Operations at Coles, to come forward and tell you a little bit about what's going on in this whole job placement partnership that the government has with Coles and the other supermarkets. Kevin.
Thank you, Premier, and good morning, everyone. And first of all, thank you for your comments around our amazing team who've done just a fantastic job throughout the pandemic. This is the 3rd year of them as essential workers, feeding all Australians. So thank you to them, all of our suppliers, our transport partners, our amazing teams in the distribution centre, and you're going to hear from Con in a second, and all of our team members in our supermarkets. A big thank you. We're so proud of what you've done. I think over the past few weeks, we've seen every part of the food supply chain has been impacted through team member isolations and workforce not being available, whether that's farmers, whether that's food processors, manufacturers, transport, and it's impacted in our own distribution centres in Coles and in our own stores. And the end result has been fewer products for our customers to buy. Our amazing team members have been working very hard to recover that, and we've been doing a number of things. Many team members have stepped up and taken on additional hours, and we thank them for that, recognising that balancing work and life and family responsibilities is so important. We've also been giving our team members additional skills, so further multi-skilling. In the run-up to Christmas, we gave additional skills to 77,000 team members so that our teams could be more flexible about how we manage some of the challenges that have been coming through. And also we've been bringing new team members into the Coles family. And we're so proud of this initiative. Throughout the pandemic, we've worked with state and federal governments on improving the situation for our customers, whether that's been DJPR in Victoria, Victoria Health, whether that's also been Emergency Management Victoria, and now with Jobs Victoria. And this is a great story of team members coming through that system and being able to come and work with us at Coles. So we've been working with Jobs Victoria, who've done an amazing job. Thank you to that team of screening those applications. And we've had over 1,000 candidates come forward, so just an amazing number that we've been working together with them and our partners to get those team members screened, interviewed, and I'm delighted to say we've got some team members who've actually started and are actually in our distribution centres. And in a second, I'm going to invite Con up to tell you his story, because it's always much better to hear it from Con. I think the last thing I'd say is that we are working hard to recover the situation across our stores and our supply chain, and things are getting a little better every day. But all of us across Coles are working terrifically hard to try and improve that, and we thank all of our customers for their patience and understanding through what's been these really challenging times. On that note, I'd like to introduce Con and let Con tell you his story. As I say, much better to hear it from Con than myself. Con.
Hi everybody, my name's Con. I'm Con Andrianis from Greenvale. I'm doing this not only for the government, but most importantly for my wife and my two boys. I was a 27-year public servant up until 2014. I left voluntarily to try other things, supermarket work, stacking shelves, customer service work, you name it, I tried it. I even did cleaning. I just like working. I've got a good work ethic. My parents taught me that. I think I actually saw this job. I've been in and out of temporary employment since I left the service through a Facebook post shared by a friend of mine who I'm eternally grateful for. I saw it. It was from Drake Industrial through the Vic Jobs initiative there. I applied for the job, and I'm turning 54 this week, yeah? I saw the job. I applied for it. Basic ID, passport, driver's license, resume. Obviously the people Vic Jobs thought I've got warehouse experience, I've done odd jobs. I was able to apply for the job, and I was working within 2 days. Now I've been through Seek, I've been through Indeed, I've been through all these other things, waited 2 weeks for a reply, you never get the reply. I was working within 2 days. So there's opportunities out there. I'm 54 years old, born in Australia. There is people who are 18, 20, 30, 40, 50, possibly 60. You got 2 arms and 2 legs, there are jobs out there for you, okay? Like I said, working in supermarkets, we're an essential industry, just like the police, the AMBOs, the medical people. They are the highest people I could possibly think of and admire, right? And thank you for the opportunity to speak freely. I'm not using the script, I'm speaking from the heart, okay? There's opportunities out there. Think about the word essential. It's vital. It's important. I'm not just a forklift driver, I'm a picker. My first job was a picker. So I wear a headset with a microphone. The machine tells me what aisle to go to, what location. I pick stock, I put it onto a pallet. I wrap it, I put it on a label. Goes all over Victoria. Okay? I think, say, those boxes of bananas or potatoes or dairy or chickens or whatever else I pick over at Laverton goes onto a pallet. Yeah, I wrap it, it goes onto a truck. It goes out there, I've picked it, I've put food on people's tables. It's an essential service. It is vital, essential, and my career has moved on. I started as a picker, and because I already had a forklift license, they recognised that I turned up on time, did the right things, did my work, listened to my boss, looked after myself, applied the safety guidelines, and I've now been given an opportunity to drive a forklift. So instead of me lifting all the stuff, the machine does it for me, all right? So I'm really grateful. I actually found out that this opportunity came through the Vic Jobs website. It's not a terribly complex registration process. Like I said, simple ID, passport, driver's license, resume. You can be any age, be born here in Australia like myself, come from overseas in the last few years. You're a resident of Victoria. You do all the right things. There's opportunities out there. People can say, oh, I can't find a job, can't find a job. That's why governments are here to help you. Sometimes if you can't help yourself, you've got to seek the help as well too. There are opportunities in this great state. I'm eternally grateful, and just want to say thank you for the opportunity, and stay safe, everybody. Cheers.
Thank you, Kevin and Con. Don't know if we should go to questions. We should just end there, shouldn't we? Thanks, Con. Can you please, on our behalf and on behalf of all Victorians, send the clearest message to your workmates, your teammates, that we value what you do. It's critically important, and we say thank you. Happy to take any questions you have.
These rapid tests that the government's going to be giving to critical utilities, will they be, is there any scope for them being free, or how much will be recovered by way of costs?
Yeah, we're not talking in the main about very small businesses. We're talking about very large businesses where we're covering our costs. We think that that's the most appropriate thing to do, and it also means that, you know, what is a pretty valuable commodity is highly valued by everybody who finishes up being everyone who finishes up benefiting from the supply of those. That's the first instalment. We don't think we'll need to do that many more to our large and most essential businesses with the largest number of furloughed staff, and those businesses that are in fact exempt from the home ISO. We think that's a good match. If we need to do more, we will be able to, most likely, as we get more and more orders coming through. But a cost recovery model, I think, just means there's a bit of competitive tension there. These things are not anything other than valuable, and being on a cost recovery basis for those industries, I think that just means everybody treats them with in the most valuable terms, which I think is good.
2,000 people have already expressed interest in the jobs. How many will actually get a job?
Yeah, look, it's difficult to say. Obviously, Coles is one business, Woolworths, Aldi, and then Metcash from a wholesale point of view. But the freight and logistics industry is a big industry. It's a growing industry. If you look at the last couple of years, you know, online is no longer some concept. It's something that we've all done, and we've all done it. Many of us probably never thought we would. That presents some challenges for other parts of the Victorian economy, particularly retail. But I think that even if a person is placed in one of these jobs for a short period of time, for months, say, that experience will be critically important to the next job application they put in, to the next part of their journey. Every time we can place somebody, that's a down payment and investment in their future. It's invaluable experience. It's getting those references, that sense that you're a known quantity, that you've done it before. That's really, really important. So it's hard to tell, hard to predict how many of those will get placed, but we think there's certainly hundreds of those 2,000 will finish up in work, and all of them, whether they're kept on in the longer term or whether it's a more short-term position, they'll all have the experience, they'll all have the benefit of that partnership between industry and the Victorian government through Jobs Vic.
Plenty of small business.
You need to have the supermarket come to you and say, this is how many people we need. You can give a sense of that, how many people
what we might do, why don't we, you guys exhaust all your questions on me, and then I think Kevin or Con can come back up at the end, and you can do whatever you want to do there. Is that the easiest way to do it? They may have some of those numbers. They can only speak for Coles, but I think that's indicative. I've had, last couple of weeks, I've had 2 or 3 direct engagements with the supermarket sector, and they've gone from having big problems in their DCs, then it became trucking was a big problem. It was very, very challenging 3 weeks ago. Then a sense of stability came to it. It's now on the improve. It's gradual, but thanks to everybody in that supermarket supply chain, so right back to farmers, to people working in abattoirs and boning rooms, people in every sector really, across that food industry, packaging, transport, logistics, everybody's working as hard as they can, and we are seeing improvements. It's not back to normal yet, but that sense of stability and gradual improvement is absolutely down to the work of people like Con and Kevin and thousands, tens of thousands more. And we're pleased to partner with them and do whatever we can to make that task just a little bit easier.
I noticed that forklift operators are on the list here. What's your view on allowing minors to drive forklifts?
Josh, it's good to see you. And I was asked this question prospectively ahead of National Cabinet last Thursday, I think. I indicated that in my discussions with the supermarket sector and the transport and logistics sector, talking to Toll, Infox, all sorts of other big companies, they'd not put in a request to have minors drive forklifts. This has been there's been a bit lighthearted, some of this debate in recent times. When I was asked my view about this at National Cabinet, I sadly cited the terrible tragedy in Victoria last week where a 44-year-old person lost their life. Coroner will look at that. Forklift driving is not easy, it's not simple, but it always needs to be safe. And that means people need to be trained and qualified. So that's not something that I could support at National Cabinet, nor something that I'll support beyond National Cabinet. That's not to say that there aren't other things that we can all do to try and make these very challenging times a little bit easier, but I reckon the biggest and most important thing is to get these businesses a supply of people who desperately want to work, who have skills, but just haven't been linked up with a job. That's what Jobs Victoria does. And to think that just in the last few weeks we've had 2,000 Victorians register an interest in going and doing work like Con does, that's just fantastic. Absolutely fantastic.
Plenty of small businesses would love to have a government agency recruit their staff and have taxpayers pay them a wage subsidy. If the big supermarkets need these workers so desperately, surely they can recruit and pay for them themselves, can't they?
Well, Rachel, I suppose it's about your outlook on these things. I think this is good news. I wouldn't nothing less than that. I'd also make the point that small businesses they benefit from Jobs Victoria as well. This is not just for big businesses. Any business across the board can register what they need, can indicate to us what they want, and we'll do our level best to connect those who want a job with those who need a worker. So this is not just about big business. I would make the point though, at times of crisis, and in much easier times, nothing's more important than getting people into work. We've focused on that every day that we've had the privilege of being the government of this state. And I'm not here to apologise for the fact that we have very, very strong partnerships with the business community, large and small, city and country, in every single industry. It's why the Victorian economy has such underlying strength, and it's why, in many respects, the success of our state dictates the success of our nation.
Premier, on
yes?
Thursday, there's a match at Amy Park, Socceroos versus Vietnam. I understand the capacity there at Amy is just under 30,000. But given across the road, the tennis has been asked to limit its crowds on sessions to 50% if those tickets haven't been sold to that level. Has there been any review of the COVID safe plan for that soccer event, given that soccer fans by nature of the sport and past experience are quite boisterous and
I'm not going to reflect on I'm not going to reflect on football fans. That could get me into all sorts of trouble. Passionate is the best word, I reckon, Simon.
Sure.
Absolutely passionate about their sport. What I'd say is this. Yes, I don't know exactly how many people there'll be at Amy, but I reckon on any given day there'd be more people at Melbourne Park. Potentially many more people at the tennis. The other thing too is that there's always a sort of cumulative effect here too. So the tennis is on every day, every night for 2 weeks solid. Now obviously it thins out a bit as you get to the end of the tournament, but I think that, well, what I know is there's a detailed COVID safe plan for Amy. There's a detailed COVID safe plan for that particular event. And I think that they'll be compliant with that plan. The exact details of it, though, I can get someone to come back to you. But I think if you looked at the number of people that are on, that are in or around John Cain Arena, Margaret Court Arena, Rod Laver Arena, not to mention outside courts, day passes, people out in the other spaces, I reckon that would be more than mid-20s. Could be considerably more than that.
Yeah.
Let me come back to you about the provisions of that COVID safe plan.
The reason I raise this one particularly with Amy Park is, albeit a different strain, during the Delta strain there was an incident where massive crowds were queuing out in front of Amy. And
Rugby match, yeah.
Yeah, and that led to
Yep.
ultimately an outbreak response.
Yep.
So are you confident this time round we won't see that sort of scene or
Oh, look,
sort
I
of
think it's...
spreading event?
Yeah, I'm confident that any gathering will finish up delivering cases. That's just the nature of this Omicron variant. And we don't really talk about outbreaks anymore. Like, I see people discuss, there's been some, events where, weddings particularly, they're often described these days as super spreader events. Well, any event where you've got a vaccine that is very effective against critical illness but not so effective against transmission of this wildly infectious variant, runs the risk that there will be cases generated. The alternative is we all stay at home, we don't go out, we have this thing control our lives, run our lives for a third year. That's not a choice I'm prepared to make. I don't think Victorians are going to make that choice in any enduring sense. Victorians have done what we asked them to do. They've gone and got vaccinated. That's why there's 1,000 people in hospital, but there's only 100 of those that are in intensive care. And we wish them well, of course. And even one person in intensive care with this virus is one too many. But it is a different challenge now than it was, and therefore there are different settings, different public health response. But it does bear mentioning yet for the 100th time today, and probably 100 times more, a third dose is so important. So important. Not just to maintain your protection against critical illness, but it does have a benefit in the transmission of this virus. It'll reduce the likelihood of you getting it and or giving it. Plus the third dose will keep you and your loved ones out of hospital in that critical care part of the hospital, the life and death part of the hospital. That's very, very important.
Can I just ask...
But I'm happy to I'll get some more details for you on the logic that sits behind that, the COVID safe plan for that event.
And just while we're on major events, can I just ask you about the incident over the weekend where Victoria Police officers at the tennis were asked to, went up to people with T-shirts talking about the Feng Shui matter, understand, out of China. Do you know whether it is up to police to enforce those sorts of rules about political messaging on T-shirts and that sort of thing, or does Tennis Australia have that kind of power under the Major Events Act, or why did police...
I'm not certain, Simon, that what happened and why would be a matter for TA in the first instance. I'd direct you to them. In terms of the Victoria Police angle that you've asked me about, I'm happy to get some advice on that, but it's not a matter that I'm briefed on. It really is a matter for Tennis Australia, who's on centre court, who isn't, and who's what sort of conduct is believed to be in the spirit of the admission and the terms and conditions of the ticket when you buy that ticket.
Should parents be avoiding...
We'll go here and then sorry. Yeah.
Sitting in the stands though and just wearing T-shirts asking about where Feng Shui is, do you think they're not disrupting anyone?
Sure.
They should be approached by security? Don't people have the right to wear T-shirts?
Well, again, I'm not going to get into a debate about those matters. People can make their own judgments about that. We're a democratic state. We have hard-won freedoms. They're all very important and valued by us. But as for this particular issue, I'd leave it to Tennis Australia to explain what they did and why they did it. That's entirely a matter for them.
Just on China as well,
The government is not involved in that, so that's the only reason I say I really can't provide you anything other than probably some gratuitous commentary, and I'm not in the business of doing that.
Just on China, the Prime Minister's WeChat account has been taken over. Do you have...
Ditto. I have nothing to say about that other than that the Prime Minister might want to have a chat to you about that. I have an account and I've had no issues with it.
Premier, should parents be restricting play dates and sleepovers as they've been urged to in New South Wales and Victoria?
Yeah, look, what I might do is get the Chief Health Officer to come back to you with some considered advice on that. I think families are using common sense now. I think they really are, and they know how wildly infectious this is. They don't want to get it. They know that that's the nature of a novel virus. We're not 100% certain about what the long-term, even the medium-term effects are. What we know for certain is that there's a bit of randomness to this. Two seemingly alike people, from a health point of view, same age, no underlying conditions, they can have two very different COVID journeys. So people, I think, are changing their behaviour. That's why it's so important that we get the third dose. That gives us that extra protection I've spoken about and all the experts have spoken about. Get to the peak of this, start to see these numbers come down. ISO is really, we haven't mentioned that today, but we thank people for getting vaccinated and we thank people for following the few rules that we have at the moment. But of course, let's not forget all those people who are at home. In ISO, staying away from others, having a very different summer than they had hoped for. That's so important to limiting the number of cases. As for specific advice, I'm not sure whether we've specifically gone to those issues, but I'm happy to have Brett or one of the other deputy chos come back to you around that. I just think common sense. By all means, try and live as normal a life as possible, but these are not normal circumstances. We've got a lot of virus in the community, and it's why we're handing out every day 30, 40, 50, 60,000 rat tests at our state testing sites, because for the best of reasons and because of so much community transmission, people need to get those tests.
Premier, just on schools, how
yes.
will it be the school's responsibility to monitor whether or not the children have had 2 rapid tests a week? Any parents or children don't meet that threshold, what happens to them?
Yeah, Mark, this is a really important issue. I can take a rapid antigen test and I can bring the little tab and I can try and convince you that I took it. Unless you saw me take it, then you can't be certain that it was me. So there was always going to be, plus we've got no system to register that, to log that in with any absolute certainty. For instance, we're deeply grateful to those thousands of people every day who are voluntarily, they're taking a rapid antigen test, they're registering their positive result. As much for them as it is for us. We get the completeness of picture, they get the support if they need it. They're part of a system. And that COVID journey, as I said, people can deteriorate quickly, it can be highly variable. There's every reason to be part of that system. When it comes to this, getting vaccinated for our kids has not been mandatory. That's a matter for parents and children or young adults to make that choice. Getting tested is not mandatory either. We do highly recommend, for the safety of your child, for the safety of your household, for the safety of every child and every household, please use those 2 free rapid antigen tests each week to test your son or daughter, so that when they go to school, just like you wouldn't send them to school if they obviously had a cold, if they obviously were sick, this thing you can have it and not have symptoms. That's where the test comes in. That's why the test is so important. But schools are going to distribute these because they've got the closest relationship with the parent community, much closer than the government. That's the way you want it to be. And they'll monitor and they'll run this as best they can. But it's basically a partnership. It's a partnership in trust and everybody working together to get the best outcome. This won't stop every case, but it will, as the Doherty modelling tells us, it'll put downward pressure on those cases. There'll be less chains of transmission, less cases, less people in hospital, because we're doing that testing.
Just to clarify on rapid tests in general,
yep.
Of the 34 million or so that we were expecting in January, how
yes.
many has the government received?
There may well have been some flights coming overnight, so let me come back to you on that. Right. But we had a couple. Oh well, I think I've made a couple of announcements of 4 and then another 7. I think we'd be very close to having the full 34. I would have thought, save and except for the fact that the ash cloud saw I think 2 or 3 flights unable to take off. They will get here at some point. But we're confident that we've got sufficient supplies to make the back to school plan announcements yesterday, to do this partnership with food and other critical industries, and to have literally 50, 60, 70,000 tests handed out every day at our state testing sites. But I'll get you, let me get you an exact number.
I mean, I know it's a federal issue, but then
Yeah.
for people who are still struggling to get them at pharmacies, particularly concession card holders who get them for free starting today, I believe, what would your advice to them be if there are shortages on the store shelves? Is it just to go to a testing clinic?
If you need it, that is to say, if you believe you are a household contact, if you believe that you need to get that test, then they are available at testing sites. You'll have to queue up for it though. It's not as convenient as a pharmacy. That's exclusively a federal government issue, one that was supported by National Cabinet. Just to be clear. But what I would say is the Commonwealth Government, Minister Hunt could speak to that. But I'd direct people to what Anthony Tassani, the head of the Pharmacy Guild, said today. This is going to be a fantastic program. It'll just take them a little bit of time, and I'm sure people will be patient. People know that our community pharmacies, our pharmacists and the people who work with them, they're some of the very best people in our state. They've done a great job so far. They work hard every day. They're professional, they're trusted, and for good reason. They'll be doing their best.
Just on the broader COVID picture with hospitalisations, ICU, so we're seeing hospitalisations start to come down,
Yep.
and obviously the case numbers we think have hit peak. Just in terms of the broader Code Brown situation and surgeries, I know you said yesterday that the government's looking at what can be done, but can that be hastened at all? Like, is there anything on the horizon for some of these critical healthcare surgeries and that sort
Well,
of thing?
Simon, I'd say this. Just like all the rules across the whole journey, they won't be on for a moment longer than they need to be. And as soon as we get advice that says, we've peaked, numbers are coming down, we think we're through the worst of it, booster performance is strong enough, all of those things, then we will resume as many services as close to normal as we possibly can. I know it is very, very challenging for people who need surgery to have that surgery cancelled. It's also, it's just not the way we operate. We've spent every day in government trying to grow the number of services that are available and make them as close to home as possible. To have to suspend services is incredibly challenging. But of course, it's most challenging for those who aren't getting that care. But as I've said to you a few times, I'll say it again. As a parent, as a partner, and as a patient last year, I can tell you, you want a health system that treats the sickest patients quickest. And with the pressure that's on at the moment, it's not about money, lest anyone be swayed by some of the silly games that are being played by others. It's not about money. It's not about machines or PPE. It's about people, because that's who delivers healthcare, people. And if 4,000, 5,000, 6,000 of them are at home, either with COVID or because of COVID, that matters. That absolutely matters. It means shifts can't be filled. It means you've got to kind of focus the system much more on those who, without care, it's a life and death thing. That's what you want to focus on. Now, hopefully that's for a short time. Hopefully some of these predictions are not realised. Hopefully we're on a better curve, a better trajectory than what some of the modelling tells us.
Are we still looking at Code Brown potentially lasting 4 to 6 weeks?
I've got no advice to change that time frame now, but no one will be happier than me. We'll all be really pleased, all of us will be really pleased if that can be shorter, but that would be based on advice and not just assumptions. This is this whole thing. We've had this discussion. How many times have we had this discussion? It's really important. Modelling, forecasting, predicting, it's all about the assumptions. It's all about what you think's going to happen. Those assumptions every day get replaced with actuals, what actually happened yesterday, as opposed to what we thought would happen. And sometimes things are more challenging than you thought. Sometimes they're less challenging. Hopefully it's going to be the latter.
What about the ambulance service? Because I know they've had the ADF helping them drive ambos.
Yes, they've had a small number of ADF who... Yeah. So instead of having 2 paramedics, you have 1 paramedic and 1 ADF, and the ADF person's trained, but they do the driving mainly, and the paramedic does the clinical care.
The question I've got, you've got 20 at the moment for
Yep.
the ADF. Will you ask for more, or will you need to, or is there a view to wind that down?
Again, I know that Tony Walker and his team are always looking for more support, because just like any other Victorian, paramedics get COVID too, whether it be more likely at home, I would have thought, and around the community rather than at work. But I would just say this, for ADF, thank you, fantastic support. We've got some public servants as well, Commonwealth public servants working out of Esther, also doing some call taking and helping out there. But there's probably more, and AV will be happy to give you some of these stats, but from memory, they've got about 600 people that they've trained, and most of them are St John's Ambulance. They're not ADF, in fact, they're St John's Ambulance, who've upped their skills to do even more and just partner with an ambulance paramedic, so that they've got something like, I think it's about 60 shifts per day, 60 line item or roster lines that are freed up because of these blended crews. I want to thank all of our ambos, thank their union, thank management, and thank all of those who are partnering with the ambulance service, because they're doing a fantastic job. Tough, difficult. It's not like normal, because these are not normal times, but they're doing their level best, and I want to thank all of them.
Where I was getting was, the broader point is, I think a lot of the other people that have been helping drive the shifts or cover those lines are volunteers, potentially Lifesaving Victoria or maybe St John's volunteers or whatnot. So that's where I was wondering, as more of those volunteers go back to their full-time work or go and man
sure.
Will you need more from the AV?
I think I would let AV speak to that, but I don't want to be. This has got very political over over 2.5 years now. ADF requests for support. We're grateful for the ADF support. I don't want people playing silly games and making mischief about us wanting more and all these sorts of things. We put in requests. We're given a fair hearing. We don't always get everything we ask for. But I'll just make this point. Like, the ADF don't have thousands and thousands of doctors and nurses just waiting to be called up by a state government. If you made such a request, 90% of those people would be reservists, and they just, instead of wearing a hospital uniform at the Alfred, they'd wear an ADF uniform at the Alfred. So it would help you not much at all. The other thing too is that just as our hospitals and our supermarkets and every sector of the economy's got staff that can't report for work because they've got COVID or because of COVID, so does the ADF. So we're very grateful for all the support that we've received. I had a number of conversations directly with the Prime Minister last week, which is what I think saw us have these arrangements confirmed. I'm grateful to him, grateful to them. But they're under a fair bit of pressure too. But we'll always put in those requests. We'll get a fair hearing, and let's hope we get as much support as we can. That's certainly been the experience to date.
Just back on surgery, there are surgeons who say they're sitting at home today. You mentioned their teams yesterday. They're saying their teams are also sitting at home, unable to work. The wards they usually work in are closed. If you really are going to only have these rules on for not a moment longer than you need them, why can't those people go back to work today and do work that will ultimately ease pressure on the health system in the medium and long term?
Well, because the judgment of the experts is that it will in fact add to the pressure in the system right now.
Do the experts know better than the surgeons themselves?
Well, some of the experts I listen to are in fact surgeons. So let's not get into you talk about political. We don't want to get into the small p political hierarchy of our health system. I'm not going to do that. But we take advice, we take soundings, we listen to a broad range of people. For the first time in a long time, the Secretary of the Department of Health is a very experienced clinician, a hospital doctor, not a surgeon, but a hospital doctor who knows and understands the system and brings that unique perspective. Professor Wallace has that unique perspective, and his judgment and the judgment of others are that we need to make these arrangements now. We need to put these changes in place now, and we also need to trigger that national partnership agreement where the private hospital system continue to play their part also, and I'm very grateful to them. I want to have surgeons back doing surgery. I want to have patients back getting the care that they need as quickly, as close to home, and in as large a numbers as we can manage. That's not right now, but it will be soon. So with the greatest of respect, they're entitled to a view. Of course they are. But at the same time, I've got very, very clear advice. Let's hope we're talking about days and weeks rather than a longer period than that. And some of the signs are promising. Let's wait and see whether we're on the kind of more positive trajectory or that more challenging one.
And just on supply chain, we have seen a pretty substantial decrease in case numbers over the past week and a half. Anecdotally, in terms of what you're hearing from business, and perhaps we can ask Kevin too, does some of that absenteeism that we were seeing, straight after Christmas, that was a huge problem, is that easing at all at the moment?
The feedback I get, and I won't speak for supermarkets because we've got someone here who can do that, but in feedback from a number of industries, particularly those who were hardest hit and those who were put onto the exempt list first, those exemptions from home isolation have had a real tangible impact. It's not to say they're back to normal, they aren't, but it has made a real difference. I think that there's been some stability come to this. Now, it was pretty bad. I don't want to be too colourful, but there was that sense that it was getting worse day on day. Then came some stability. Now's coming the gradual improvement, and that's really very, very important. But, how many times in this room have we talked over these last couple of years about the meat industry, whether it's red meat, white meat, and even seafood? You're talking about cold temperatures, people who work in close proximity, like it's a perfect environment for this virus to absolutely flourish. We've got surveillance testing in those environments for a reason, and that's meant that we've found a lot of cases, we've cut off transmission chains, but it means a lot of people have not been available to work. So we still see some big challenges in that part of the system. There are some commonalities to all sectors, but each sector's unique. It's not my practice to tell business what they need. We instead listen, and the feedback I'm getting is that it's better, but it's still quite a way from being normal, and that's why we'll continue to support them and their workers and their customers.
Premier, it appears that Novak Djokovic will be allowed to play at the French Open. There are reports online that there's been a tweak to the French vaccine passport rules. Can I just invite you to...
I'm not.
His absence in the Australian Open...
I'm not aware.
Do you think it'll look...
I'm not aware of that. Look, I'm not going to... Oh, look, yeah. I was almost going to say something about a certain clay specialist who... No, I won't say anything at all. But Rafa had it right. Just get vaccinated. It's really simple. Just get vaccinated. Just get vaccinated. And all this could have been avoided.
WA's Health Minister has defended their border decision by saying the eastern states are essentially in lockdown. Is that how you would describe our situation?
No, but I'm not here to have an argument with the government of the West. I can get our ambassador to talk to theirs if you like.
Just talk schools for a minute. Some schools have told parents that children will have to wear masks across all age groups and inside and outside. Should they be going above and beyond the restrictions if they want to, or should they try and keep as less restrictive as possible?
Well, I think it's important that the point in your question, you've acknowledged that it's not a matter of government policy. It's grade 3 and up, and it's inside. If school communities want to go further than that, then they're free to do that. But we want the rules followed, and that's grade 3 and older. And it's inside; it's not outside. But school communities can go further if they choose, and not just in that way. In lots of different things they can do.
And how does it work with a positive infection? Is it essentially the school's job to decide who's a close contact and how many people they inform? How does that sort of play out?
No, so what'll finish up happening, and I'll get you the precise words because this is not unimportant. We went into this a little bit yesterday. The school would the health department will be informed by, public health will be informed by the parent, because most logically the test will be done at home. The positive will be known to those in that household bubble, in that household. They would tell the school, then the school will share that information with the relevant group, whoever that might be. Might be the whole school, might be the year level, might be the class. But it won't be to say stay home. It'll be, right, there's been a case, your son or daughter may have been in contact with that person. There's a case, the virus is in our school. Please monitor for symptoms. Please use the tests, the 2 tests. And if you are positive or if you have symptoms, because you can sometimes have symptoms and not necessarily get your result for a little while, not necessarily record a result, please stay at home. If you're sick, please stay at home. So it's a test to stay approach, if you like, but it's broader than that even. It's everybody across the board testing with the full and certain knowledge that there will be cases, but the more of those we find, the more of those will be at home, isolating, not infecting everybody else. But there's going to be cases, of course there is. You know, you've got hundreds and hundreds of thousands of kids that represent hundreds and hundreds of thousands of households that are currently not linked in any real way. They're about to be, because all their kids are going to be going to school. Plus you've got teachers and staff. I think that what New South Wales and Victoria have done is exactly the right way to go. School being back day one of term one, critically important. But at the same time, we need to make the environment as safe as we possibly can. Not for zero cases, but for less cases than would otherwise be diagnosed or would occur if we didn't do that important surveillance testing. No more for me. Very good. I think Kevin and Con are happy to answer any questions you have of them. Or not.
Yeah, if we could chat to Cole.
Jump up, Cost. I'll have a few questions for you.
May I ask Con a question first? That's all right.
No worries.
Go for it. Thanks for chatting before. It was great to hear your story. Have you found many of your colleagues have done a similar thing and they had to look for work in those sorts of means?
Yeah. I've got a great example. I met a man who's just started in the last 3-4 months, 51, a couple of years younger than me. His exact words were, "I apply for a job, next day I start work." That's what he said. So these are guys from various backgrounds who have worked in transport, who have worked in offices, call centres, mail rooms, cleaning. There's opportunities out there. And the gentleman here who said something about forklift driving for minors. Just like any driver's license, you need to be over 18. You need to do a course, be certified, and be, you get ticked off to say that you're suitable. Not everybody gets a forklift drive license. You know, I'm a 54-year-old man and I've got 1,000 kilos hanging over my head. It's not an easy job. Yeah, but as I said, I've found people who have come to the country in the last couple of years who are from other countries, and people like me, born in Australia, who have come from various backgrounds, and they've had no trouble doing the work or performing the work. And I find it physically and financially rewarding.
Fantastic. And do you mind me asking you what role you played in the public service before you left?
I've worked for several government agencies, federal, yes.
What do you think the main obstacles are for people getting into work? Is it just realising that they need to sort of put themselves forward and then it's, not so difficult once they're there? Or?
Correct. I think that's a really good thing, if you don't mind me saying. I didn't come prepared for this, by the way. Never done this before. I guess it comes from your own work ethic. I think for me, my parents came here from another country, never got fussed about what sort of work they did. Could be cleaning floors, could be stacking boxes, working in a factory, whatever. You might not have the qualifications. I've got limited qualifications. I've got a Certificate 3 in finance, all right? And I've got a forklift license. But I think it's a matter of not being fussed about what sort of work you want to do.
Just got to have the right attitude?
Huh?
You just got to have the right attitude?
I think so, yeah. I mean, my mother was the best. She said, if you've got 2 arms and 2 legs, you can get up and do it. Yeah? That was her greatest saying. To say, if you can stand on your own 2 feet and be able to lift a box up to 15 kilos, which we've got people who are 4 feet tall, we've got people who are 7 feet tall. They're fulfilling orders for supermarkets, yeah? So I think anybody who's willing to do the work and willing to apply the right ethic, they can do it, yeah.
And you touched on that forklift, miners driving forklifts idea last week. What did you make of that proposal?
I did not hear. I just thought maybe I thought I'd just maybe help out with that. Yeah, I think I think if anyone who is over 18 and does the right training course and gets ticked off, I think any responsible forklift training agency would make sure the suitable people get out there and do it. Who are reasonable. If you're bumping into things and knocking things over, you shouldn't be driving a forklift. Yeah.
May I ask Kevin a question, if I can? 2,000 expressions of interest
Oh, we've got several thousand live vacancies at this point, so I think this is a great help towards that. But we're recruiting in many different ways, and candidates come to us in a number of different ways. I think that's just kind of a sign of the times of different people come to Coles in a different way, but we're happy to use them all. But yeah, we still have lots of opportunities.
And do you see the staff shortages being a rolling issue throughout the year?
Look, it's really difficult to say, isn't it? I don't think any of us would have thought we'd have been in year 3 of a pandemic and facing the challenges we're facing. So it's great that we have been able to bring on more team. We have had a considerable rise in team members over the last year, and who knows what the future will bring. But many of our team members want to get some holidays. They're all working incredibly hard on that, and I think this is a great way of continuing that.
We've got record low unemployment at the moment. Does that present opportunities for people who you might not otherwise consider, because I guess it's a less competitive environment for people applying for jobs?
Look, I think we've always been relatively lucky in Coles in that we've always had a strong pool of applicants. And what's great is that, you know, all of our stores and our distribution centres are representative of the community that those team members live in and work in. So, you know, it's one of the best bits of my job, being able to go and visit the DCs, and you've heard from Con and our supermarkets. But actually our team are representative of that. And as I say, you know, we've got a very broad kirk in Coles, but we're immensely proud of that diversity, and it's one of the things that makes Coles Coles, in my view.
Kevin, the Premier was asked about skills shortages and whether or not the situation's improved somewhat. What's your experience there? Do you think things are gradually improving, or is it still a very critical sort of problem?
Look, from a wider supply chain, I think I said earlier on that, you know, this impact of COVID, isolations and associated impacts have been felt right through the supply chain. I would say as of today, it's getting a little better each day. We're not back to normal, and I'd never stand here and suggest that. There's still lots of work to be done to recover. But if I think about week on week, it's better. And if I think about from where we were 2 weeks ago, I think it's better today. In the stores that I spent time in at the weekend, certainly our store teams are telling me that, and our distribution teams and our suppliers, we're seeing that play through. But there's still lots to be done to recover from here, and obviously the challenges that are still to come.
The Premier's indicated there have been challenges in distribution centres, the last week was trucking. Is there a new challenge this week?
I think the end-to-end supply chain is really complex, and to the Premier's point, you know, we have lived absence in our distribution centres being very high. That has somewhat come down. It's still not normal yet, but it's better. We've certainly felt that with our transport partners. We've seen it in the meat industry. Many of you will have seen the impact on shelf in meat that's come from both primary and secondary producers. I think it's understanding that end-to-end supply chain is complex, and where you have a bottleneck in one area, that creates ongoing problems through the rest of it. So I think we're all very, very focused on getting back to where we want to be, and then making sure we've got as much resilience in the supply chain to move forward.
Kevin, I know you can't comment on your partners, but how many people within Coles at the moment are isolated, or as a result of being a family member, a relative, or actually are positive?
Yeah, look. So we wouldn't talk about specific numbers, but roughly, you know, our absence in stores would be around 10%. In our distribution centre, probably double that and a little bit more. But I say both of those.
Improvement?
Yes.
So
yes.
how bad did it get?
At times in our distribution centres, we're above 40% absence.
Thanks very much.
Thanks
Great.
a lot.
Thank you.
Yeah.
Thanks for coming in.
Thanks, guys.
Thank you.
I think he could make a career of this.